This presentation is brought to you by the UAMS Dental Hygiene Program and was researched by Caitlin Boatwright. Today, we will be discussing the Advanced Dental Hygiene Practitioner. These are the objectives. Be able to explain what an advanced dental hygiene practitioner is and their purpose in the dental practice setting. Identify when this position was started and accepted in certain areas or states. Be able to identify which states accept this mid level position. Be able to explain the scope of practice of an ADHP. Be able to explain the advantages an ADHP can bring to a dental practice. And identify why ADHPs are not widely accepted in all states. A little history of the ADHP. The idea of a mid level oral health care provider actually came about in 1921 in New Zealand, where they utilize what they call a dental therapist or dental nurse. These providers can assess and clean teeth, diagnose common oral health problems, can educate patients on decay prevention, and actually fill decayed teeth. They can also do extractions, but only on primary teeth. In 2006, the first class of dental health aid therapists graduated and began to work in Alaska. Alaska's DHAT program is what marked the introduction of the dental therapist to practice in the United States. A DHAT provides emergency care only, such as pulp capping and extractions. The Advanced Dental Hygiene Practitioner was created in 2004 by the American Dental Hygiene Association. While this position has not been accepted in Arkansas, there are a few states in the U.S. that are able to utilize this position. The first bill to establish the ADHP into law in the U.S. was signed on May 13, 2009 in Minnesota. So what is an ADHP? An ADHP is a mid-level oral health care provider, similar to that of a nurse practitioner to a general physician. They provide care to people in areas with inadequate access to care. They are licensed to not only provide the traditional dental hygiene services, such as non-surgical periodontal therapy, sealants, fluoride, OHI, nutritional counseling, but also able to diagnose and treat oral diseases, perform minimally invasive restorative services and uncomplicated dental extractions, and also able to write and dispense prescriptions for analgesics, anti inflammatories, or antibiotics. They also provide referrals for the patient that has needs outside of their scope of practice. So, how to become an ADHP? For education and licensing purposes, you must graduate with a bachelor's degree in dental hygiene. You must also pass the MBDHE and the clinical board examination for the state or region that you plan on practicing in. You must also return to school and graduate from a master's degree program in dental hygiene. You must complete 2,000 clinical work hours, and for some programs, an internship may be required. So, the scope of practice of an ADHP, they can perform uncomplicated extractions, provide oral health education, can still take radiographs. They provide that full range of dental hygiene preventative services. They can prescribe medications and do simple restorations. This graph here just shows a comparison between the traditional dental therapist and then the advanced dental hygiene practitioner. The advanced dental hygiene practitioner does everything within the realm of a dental therapist, but also can diagnose, can provide a treatment plan for patients without prior authorization of a dentist. They also refer patients out when the needs are outside of their scope of practice. And again, they can provide prescriptions if need be. These are the states that currently have an oral health workforce model that reflects that of an ADHP. They are called by different names in the different states and also slightly differ in their scope of practice and requirements for education and licensure. But these states include Minnesota, Maine, Connecticut, Georgia, Kansas, Hawaii, Massachusetts, Texas, New Mexico, South Carolina, Washington, Vermont, and North Dakota. These three states are the current states that are trying to create legislation to move their state towards having an ADHP. These states include New Hampshire, Idaho, and Michigan. These three states, per my reviews of several articles and through my research, it seems like their struggle to break through is through finding funding for implementing these programs. So, advantages of the ADHP. They don't replace dentists, they just help to meet an unmet need and provide extra access to care. They also could save a dentist an estimated $50,000 a year compared to hiring a new dentist. They also allow dentists to take on the more complex cases instead of focusing on some minimally invasive treatments, so it can increase productivity of the dental office. It also can allow the practice to take on more Medicaid patients if the ADHP is utilized. And again, the ADHP is ultimately to provide people with more access to care. So the current arguments against the ADHP and why it's not widely accepted is because there are still some people that think it's unsafe and may jeopardize the well-being of patients if the ADHP is approved. There's also complications with reimbursement. They don't exactly know how the ADHP will receive their funding. Also, there are some dentists actually against it because they think that it may eliminate or decrease income generation for future dentists in the field. Here are my references, and thank you very much.